My name is Rosie Boltman. I use she, her pronouns, and I am affirming the resolution that this House regrets the practice of offering financial incentives to participate in medical research studies. We define this House as a rational individual. We define financial incentives as money provided by experimenters to convince participation. So it's like specifically for coercion. And we define regrets as doing more harm than good. So we believe that you should be weighing this around on net benefits. If we prove that financial incentives to participate in medical research studies is net harmful to society, then you should be voting for the government today. And we define medical research studies as studies done on human participants for medical purposes. Okay, so our contention one is that financial incentives lead to bad medical research. One, low-income people are often more likely to do risky things for money. If you have rent to pay and you really need to come up with that money, you're more willing to get money than if you don't have to worry about rent at all. Furthermore, these people usually don't have other ways to make as much money. If you're working a minimum wage job and this financial incentive would pay you more for your time than that, then you're more likely to accept it. Two, rich people or high-income people are less likely to do risky things for money. This is because they have jobs that pay them probably more per hour than the financial incentive would offer, and there is less return for the risk. You know, they're not going to be evicted if they don't take the financial incentive. They're pretty much going to be the same, except they're going to have a little bit more money in their pocket. Three, income and health conditions are closely related. So people who are low income are more likely to suffer from things like asthma, cancer, obesity, heart attacks, and also for these things to be undiagnosed. And like this is due to like the places that they work. If you're working in a factory that has a lot of harmful fumes, that's more likely to be a low income person. If you're working in the fields like picking food, that's more likely to be a low income person. And the fumes from pesticides or like in a factory and stuff, those are all likely to contribute to health conditions. Furthermore, low-income people are more likely to be stressed out and have stress-related health conditions like an elevated risk for heart attack and things like that. Four, income and age are also closely related. So the data is likely to skew young if you allow for financial incentives because young people are less likely to make as much money as older people. Five, we can see that it is essential for medical research to be done on a uniform population. There was an example of an obesity drug being tested, and it was only tested on people who were extremely obese. And it was really effective on those people. However, when it was used on people who were moderately obese or just slightly overweight, it actually had basically no impact. And therefore, the risk wasn't like outweighed. So this is an example of a population skewing in one direction and getting inaccurate results. You can also see that if a population skews one way, you could get really bad side effects or no side effects at all for a certain drug that for a different population would actually have side effects. Okay. And that was 5. 6, you see an increased risk of bad data because of financial incentives. This is because the population is more likely to be skewed and the results of the study are more likely to be skewed and less likely to be accurate when trying to apply it to a uniform population, basically making it almost impossible to get medical data that can be applied to a uniform population. So the impact of this is you see just worse medical research. Our second contention is that financial incentives mask danger. One, we can see that people are more likely to do things for money that they wouldn't do otherwise. A lot of jobs that people work, they're doing it exclusively for the money, not because they actually like it. Two, we can see that people will do dangerous things for money. A lot of TV shows and game shows have people doing pretty ridiculous and dangerous things for money. And also a lot of people work really dangerous jobs that they wouldn't work otherwise in order to get money because it is something that they need. Three, we can see that people weigh the pros and cons of participating in a situation more rationally when no money is involved. This is because they are able to think about whether or not they want to do something rather than whether or not they need to do something in order to survive. 4, we can see that financial incentives blind people from being able to be the most rational actor. This is because an incentive is involved, and sometimes this incentive centers around a necessity, like being able to pay somebody's rent. 5, this means that medical experience often pose a very large risk because people aren't weighing the side effects as rationally as they would otherwise, and people are more likely to participate in dangerous experiments. And 7, we can see that experimenters, while experimenters know that people are more likely to participate in dangerous experiments, experimenters will try less hard to make experiments that are safe because they always know that they can have a sample size if they offer a financial incentive that is large enough or big enough for people to, take it. So the impact of this, you see an increase in health risks because of side effects from, medical experiments. You see an increase in death, and you see an increase in low quality of life as a result of living with different medical conditions. Our contention 3 is that financial incentives increase the potential harms done by the experiments. First, we can see that low-income people are more likely to participate in these experiments, as I've already illustrated. 2, we can see that low-income people are also less likely to have health insurance or money for medication. 3, we can see that medical experiments are often risky and pose the risk of people, having a health side effect as a result of taking a drug that people were trying to test out. And 4, we can see that when low-income people disproportionately participate in these studies, the harms of the experiments are worse. This is because if a low-income person gets a negative health effect from participating in an experiment, they are less equipped to handle it, and they are less able to, treat themselves because medicine and health insurance are really expensive than if a high-income person were to get a negative health side effect. While it's still tragic, they are more likely to be able to treat it. So we see the impact of this is, again, just more negative health effects, more amplified negative health effects. And so for all these reasons, I urge a government ballot. Thank you.
Okay. Just as a quick off-time order, it's just going to be the negation case, then the affirmative case. Is anybody not ready? With that, I'll start time now. Hi, my name is Alex Briggs, and I'll be the first speaker for the negative team under today's topic again, that this House regrets the practice of offering financial incentives to participate in medical research studies. With that, let's go into our first contention, which is going to be that of medical research. The claim, or what we're going to be arguing here, is that essentially financial incentives are crucial for the advancement of medical research. And we have basically 2 different warrants for this. Firstly, we'd say that just one warrant for this, financial incentives boost recruitment. So this is for 2 reasons. First, we'd say that I think this is relatively obvious. When you are paid to partake in a medical study, there is a much greater of a reason for you to actually do it. I think the AF makes this pretty clear, but if you are paid to participate in these studies, there's going to be the reason for you to do it. Secondly, if people aren't going to be paid, then they won't see any reason to participate in these studies. Specifically low-income people, as they state, won't see any reason to partake in the studies. And given that they could put them in danger as well, given that a lot of these studies are particularly dangerous, a lot of these medical research is particularly dangerous, as it can lead to things like death, as it can lead to severe disability, people who aren't going to be paid for this are going to be significantly less incentivized to participate in it. So let's look at the impact of this. Essentially, we'd say that this leads to less participation in medical research overall, as it switches to just strictly having affluent people in these studies who have the time and who have the ability to go into these studies, whereas people who are low income wouldn't go into these studies anymore. We'd see that there'd be a decrease in medical innovation because people will no longer participate in this research. And this is going to be bad because it would lead to less medical advancements that can save people's lives, right? If we don't have the amount of people that we need to strictly like have this research and be able to test a lot of the like research and the drugs that we're going to be making. And that's going to mean that a lot of these risks are going to be amplified. We don't have the ability to get these drugs on the market. And that means that there's going to be significant risk in the status quo, not only that those drugs could be extremely harmful, but that we won't even be able to get them approved in the first place because we don't have enough people to test them on. We'd say that overall, this would just lead to less medical innovation, which would be the biggest impact in today's round, because obviously it's a prerequisite to any of the impacts that the affirmative talks about in terms of having these incentives and causing danger. Okay, on our second contention about medical diversity. The claim that we're going to be arguing here is that financial incentives increase the diversity of subjects of medical research, decreasing disparities in care between different groups. Firstly, we'd say that there are drastic differences in the quality of healthcare between racial groups. Lots of doctors in the status quo believe false myths about minorities. For instance, many believe that like these are obviously bad views, but many people believe that like Black people can feel less pain. And as a result of that, on average, they're prescribed fewer medications. Additionally, these people often also receive worse treatment for things like stroke, HIV, and cancer, among many other disparities, among different minority groups. Secondly, we'd say that all of this, as well as clear examples in the past of historical racism, like the Tuskegee syphilis study, where Black men were exposed to syphilis, denied treatment, and then lied to about the whole thing, have bred essentially this deep mistrust of the medical community with many minorities. And third and finally here, we'd say that without financial incentives, the only reason people would want to do research would be out of curiosity and a desire to help the medical community. Minorities who've had this basically historic history of being experimented on by the medical community and receiving drastically worse care, without that incentive would be obviously understandably less willing to follow these incentives and participate in this medical research. What would this do? We'd say that firstly, as an impact, this would lead to just worse treatment overall for minorities. Certain treatments might affect different minorities in different ways. If a medical research isn't diverse, then the drug might have adverse effects on a certain minority that wasn't accounted for in the first place. Two warrants for this. First, we'd say that worse treatment for minorities furthers their distrust of the medical community even more, significantly increasing the impacts of this argument. Essentially, we'd argue that it's a cycle. If these people are going to be seeing that worse and worse treatment is going to be occurring, that means that their distrust is going to be even more increasing, which means that the continual amount of people participating in these studies is just going to go down overall. But secondly, we'd say that trust in the medical community is uniquely important right now with COVID-19 and things like, obviously being in a pandemic where people need to get vaccinated, people need to wear masks, people need to stop the spread of infections in order to pertain the virus and pertain people from obviously being sick. So we'd say that trust in the medical community is key because it leads to COVID-19 being solved, preventing a lot of the infections that we're seeing in the status quo and preventing that from spreading to other people. We'd argue that this argument, essentially diversity, is going to affect the minorities that the affirmative is talking about much more than they themselves are able to account for them. Because when we have these people who are specifically going to be, put aside by this medical research, we're not for those people, going to lead to wording for them, which is obviously a huge impact in today's round and much more important than a lot of the app arguments. Okay, let's go to the affirmative case. So they talk about how financial incentives lead to bad research, and we have a couple responses for this. They talk about how low-income people need the money to be able to participate in these studies. Okay, here's the problem. If they get rid of the financial incentives, right? If they don't have the financial incentives anymore, that means that this case completely flips on the affirmative's head. Then all you're going to be seeing is affluent people participating in these studies. That means that the treatment of these minorities is just as bad, if not worse than it already is, because people, and specifically affluent people, are going to be the only ones who are participating in the studies. These people are the only one who have the time and the money to be able to withstand not working, not going to work and participating in a medical research study instead, right? That means that bad research is actually going to increase under the affirmative side. They also talk about how young people will specifically, right now, young people are the ones who participate in the studies as a result of the financial incentives. Okay, get rid of the incentive. then you're just going to have old people do it, right? You can just flip these arguments on top of them. There's no solvency that they're actually going to have, because when you get rid of the incentive, you're just going to be seeing that all of the people who don't want the incentive or who don't need the incentive to participate in the medical research then just participate, which means that you have just as bias of medical research that you did before, which means that all of these arguments that they talk about, like people who are obese, all of these arguments that they talk about, such as being able to solve for better research, they're not actually able to do at the point where they just reverse the actual people that they're testing on as that they had before. Okay. On their second argument, they talk about how like financial incentives make it so people don't realize like what the harms of these specific medical research is. First, we'd argue that there's informed consent in the status quo. Medical research is based on this, which means that people are told the specific risk and how much risk they're going to face before going into the research. They are also told like what stage the medical research is in and given all the participable or all the possible risks, which means that they already know what the actual dangers are. It's not like these financial incentives are key to that. They're basically already told this in the before. So it doesn't mean that you need these financial incentives to be able to do it. Also, this is going to create just worse like medical advancement overall, because if you get rid of these incentives, that means that again, people don't participate in these studies. That's a key argument. If people don't participate in the studies in the first place, there's no way they can talk about how this is going to actually increase safety. It's going to decrease safety overall. And finally, on their third contention, they talk about how this is going to increase harms. Again, people who participate in medical research are given treatments after that research. It's not like you just go in and then do nothing after. These people are given specific treatments. And then also, like, this contradicts the other argument. They talk about specifically how people aren't going to like minorities can't handle it. But if minorities can't handle it, then why would these people be participating in the first place in the studies if they can't handle like a lot of the effects of those specific treatments?
Okay, so I'm Kai Taiken. I'm the second speaker for the government. Before I begin, if you have a point of information, I need you to say it out loud because I'm using Google Sheets for my flow, so I can't see if you like raise your hand or type something in the chat. And I have 2 questions. I have time. Yeah? Cool. All right. Let me just set up my stopwatch. Okay. So I will start my time now. Okay, so beginning on the opposition case, we're going to do line by line analysis. Their first contention is about medical research, right? So they say the financial incentives help medical research because they boost recruitment, right? We're going to contest this right away. They do not boost recruitment, they just shift, right? They just shift recruitment. There are a lot of people in the world, there are a lot of people who could get involved in these experiments. And the idea that without financial incentives, these experiments would be like understaffed, like wouldn't get enough participants, simply doesn't make sense. You can reference the fact that there are plenty of unpaid medical experiments in the status quo, plenty of experiments without medical incentives, and people still do them anyway. There's not a problem with getting enough volunteers, right? So disregard this point. It's not about boosting recruitment, it's just about shifting the recruitment towards specific demographics, right? Which is actually a problem, messes with data, as you can see from our first contention, but we'll get into that in a little bit. So the next point they make is that nobody would participate without the money, right? Again, like reference the fact there are plenty of experiments in the status quo that do not provide financial incentives and that people still participate in. And also reference the fact that often these experiments are not as dangerous because financial incentives, like we said, and as they didn't really respond to, are often used specifically to get people to do experiments they otherwise wouldn't do, right? If experiment has not too much risk, not too much danger to the participant, and that's very, very clear, you don't need the financial incentive to push them to do it, right? Anyone who's interested in the research, anyone who thinks the research is important would be willing to do it. You could have a medical professional. You could have someone who works as a nurse or a doctor or a hospital attendant who is seen firsthand. Anyone who thinks that medicine is important, which is a whole lot of people, right, will be willing to participate. People are willing to volunteer their time regardless of the financial incentive. Disregard this point. People will still do it. You can see this in the status quo, right? So then they make this point that low-income people won't participate, that all low-income people will leave. Again, I don't think this is giving nearly enough credit to low-income people, especially in the circumstances of an experiment that is not clearly dangerous, that will not clearly potentially like harm the low-income person, right? A low-income person, like they can do it, right? Low-income people do care about the state of medical technology, about the state of medicine. That affects them too, right? The only situation where a low-income person is more likely to do something because of the financial incentive is if the experiment is potentially like threatening to them, potentially risks their health, right? That is what financial incentives are used for. That is what makes financial incentives harmful, because it like coerces low-income people to participate in these studies, right? So in the world of the government, if you regretted financial incentives, if you imagined a world without financial incentives, what that would mean is that like scientific researchers would have to make their experiments safe enough that people would be willing to take the experiment without the financial push to push them over the edge, right? That people would be willing to take it because it's safe enough and not because they might get hurt, but it's worth it for the money. Continuing to move down the flow, they say that this is going to decrease the quality of medical technology, right? There's a lot of clash over this point. We're saying that the practice of financial incentives actually decreases the quality of medical technology. So their second contention is about medical diversity. They say there's a difference in quality of healthcare. They cite all these terrible things the medical community has done to Black people, to people of color. I guess I'll take your POI.
You mentioned that you think researchers should try and make their experiments safer. Like, what specific things do you think those researchers should do?
I am not a medical researcher. I don't know a lot about this specific field. Right, they can test on animals. They can try to avoid fields that are clearly going to hurt a person. Right. I mean, you would have to talk to a professional about this, but there are definitely things that people can do. And like if a medical researcher knows that less people are likely to get involved in the study when it's harmful, right, and they don't have the financial incentive to push people to do it, they will have to find ways to make the experiment safer, right, so that more people are willing to do it, so that less people are clearly not going to do the experiment because it could hurt them. Right. They'll have to find ways, and medical researchers can always find ways. So continuing to move down the flow, I'll get attention to about medical diversity, all of this systemic racism in the medical field towards people of color, right? We're going to say right now, side opposition does not solve for this, right? Financial incentives are not the reason why the medical community has treated Black people horrendously. The reason why is because of generations of systemic racism, because of eugenicist science, right? It's not because of financial incentive. It's because a lot of the people in this field historically have been deeply, deeply racist, right? It's just shaped national history. And I'd also like to point out also that in the status quo, the medical community is decently diverse, right? I mean, historically, the medical community has also been able to, has been more willing often to admit people of color than many other like higher paying fields like law, right? And so, especially in terms of like nurses, hospital attendants, there's a greater diversity. And we would argue that when you get rid of the financial incentive, these people are more likely to participate. They are more directly linked to the healthcare benefits themselves, right? They have more of a direct stake in it, regardless of the money. And so we would actually say that this could increase the diversity of the field being tested. And we would also just like to point out again that the medical community should not have to bribe people to get involved in experiments. They should be able to convince them the experiment is actually safe, that they're not hurting them, without trying to put in this additional thing like, oh, also here's some money in case you get hurt, right? I'd also argue for point 4 that money doesn't eliminate distrust, right? Especially in the area that side opposition is talking about. This distrust runs very, very deep. They talked about the COVID vaccines, right? And I'd like to point out financial incentives were offered for the COVID vaccine, and there's still a deep distrust in the vaccine, right? There's still plenty of people who are not taking it. There are Black communities who know that the government has done terrible things to them before who are still not taking the COVID vaccine, right? So it doesn't just eliminate the distrust. In fact, in some ways, financial incentives could increase the suspicion, because people could see, oh, the government or this researcher is trying to buy us off, so there must be something wrong with the experiment. Continuing to move down onto the government flow. So on the government flow, our first contention was about bad medical research, right? This is basically in direct opposition to their first contention. And they're basically just saying that we're flip-flopping this, right? They're saying that all of the low-income participants are going to leave, that like younger participants are going to leave because they're only staying for the financial incentive, right? I'd argue that they're not all going to leave. It's more that we're going to balance out the field, right? The young people who are only participating for the financial incentive, the poor people who are only participating for the financial incentive might leave, but there will still be plenty left. So it's not like all of a sudden we have like disproportionately too many old people and rich people. It's more that it balances the field so that there's a roughly even field between poor people, rich people, old people, young people, right? Which makes for more accurate medical research. The rest of this analysis is dropped, right? All of the points about how low-income people are more likely to have health conditions that could get in the way of the experiment also dropped, right? So extend the rest of this contention through. So contention 2 about how the medical research is worse, right? They say that there's informed consent in the status quo. People are told the risk. We have a couple of reputations for this. First off, people are often told in language that is explicitly confusing and obscure, right? If you ever watch a pharmaceutical advertisement, they'll talk about the side effects, but they'll talk about it very, very fast in a monotone at the end, right? Like people often don't see these things. And second, this drops all of our analysis about how even when people are told, they're often not able to make accurate risk assessment when there is a financial incentive involved, right? When there's a financial incentive involved, you're not thinking about like, is this safe for me? You're thinking about like, is it worth the potential for me to get seriously injured, to be seriously negatively impacted by this experiment for the money? And if you're a low-income person who could really use that money to help pay for rent or food, you're more likely to say yes, and you're more likely to put yourself at risk. And as we proved in contention 3, which went mostly uncontested, if you are a low-income person and you get like harmed by one of these experiments, the impact is higher for you because you have less access to healthcare, to resources that you could use to bounce back from whatever harm is done to you. They say, they also just say again here that like nobody will participate in the studies. Just cross-reference everything that I've said about people. People will still participate in the studies. There's plenty of people. People are passionate about the research. People believe that this stuff matters. And like, I mean, for proof, all you need to do is look at all of the experiments in the status quo where people are not offered financial incentives, and plenty of people do it anyway. It's not a disproportionate field. There's not a problem with not enough people. It gets done. So on the third contention, this contention is barely addressed. All that they say is because first off, they say that people are often given treatment afterwards. We can't really say this is true, right? Like a lot of medical researchers will not do this. Like it doesn't happen in all cases. There are long-term effects also. And then they kind of explicitly concede that they're participating because of financial incentive, like despite risk. And this should turn to us, right? This actually government. Thank you so much for your time. Please vote for side government.
Okay, is anyone not ready? All right. For my order, I'm going to be addressing opposition arguments first and then affirmative. Is anyone not ready? All right, time starts now. Hi everyone, I'm Colin Goyle on side opposition representing Menlo Atherton. I'd like to begin my speech by addressing my opponent's responses to our first argument about medical research. We basically said that if you take away the financial incentive for medical research, like if we imagine a world where there was no financial incentive, people would be less likely to participate in medical research. My opponents say this isn't true. They say that people are willing to participate in medical research. However, think about this logically. If people were perfectly willing to participate in medical research without any financial incentive, why would researchers offer financial incentive in the first place? If it was like, if they would have received enough volunteers anyway, why are they wasting thousands of dollars? It can be up to $2,000 for risky experiments. Why are they wasting thousands of dollars for something that's not even necessary? This obviously makes no sense. And I think my opponents themselves agree with this. They say that people will only participate in safe experiments if you don't have a financial incentive. If we imagine a world where there was no financial incentive, people would only participate in safe experiments. They say that instead researchers should focus on making experiments safer. They mention things like animal research. However, I think that my opponents show a firm misunderstanding of how medical research functions. It is not possible to just make medical research safer. I mean, that's the entire point of medical research, to understand how it works in the human body. My opponents mention things like animal testing, but the problem with this argument is that animal testing, it's animals, it's not humans. Humans have such a different humans have such a massively different immune system. They have massively different, pretty much every single system in humanity is different from animals. There's no possible way to know for sure if an animal test is going to work the same in humans. There could easily be adverse side effects. Look to how pretty much every really, really dangerous virus and disease in humans actually came from animals before. So it just shows how different immune systems are. Yes?
Then how can... I'm so sorry. Then how can you explain drugs that are extremely common that were proved safe already on like chimpanzees and stuff like that? You don't think that that provides any data in terms of how safe a drug is?
I think that, I mean, first of all, if a drug is moved onto human research, it's already past animal research. Like, you don't have drugs that are designed in a lab and then with no testing, they just inject it into humans. That's just not how medical research works. It goes in many stages. First, animal testing. If animal testing is accurate, they'll do it, and then they'll move on to human testing. What my opponents firmly misunderstand is that the financial compensation and the risk, like the financial compensation you get for the medical research directly corresponds to the level of testing the medication is already received. My partner mentioned this a bit, but I'll expand more onto this. There are basically 4 different categories of research that a drug can have in human experimentation, categories 1 through 4. Category 1 is the most risky. It means that the drug hasn't been tested very much, and therefore it offers the most financial compensation. And category 4 means the drug has already been tested quite a bit, therefore it offers the least financial compensation. The problem with this argument is that category 1 testing is useful and is actually required. When you solve really, really dangerous diseases, you're not going to have like a body of research. You're not going to have a bunch of previous research so that you don't actually have so that the research isn't as risky. When you're trying to develop solutions for actual dangerous diseases, that's because there hasn't been solutions before and there hasn't been proper testing before. Risky research is the only way to solve for new disease for like new diseases. For example, the RNA vaccine. There was no research in how RNA worked and in how like our current vaccines worked before we started researching them. Therefore, they all would have been category 1 at the very beginning when we started researching them. But if we never participated in that category 1 testing, it wouldn't have they never would have been developed, and we would never have the vaccines that we have now. The problem with this is that my opponents themselves admit that if we didn't have the financial incentive, people would not want to consent to risky testing, which means less medical advancement. It means less medical innovation. It means that deadly diseases do not get solved. When people test solutions for cancer, that is not a category 4 test. It's a category 1 test. And on the second argument about medical diversity, my opponents just fundamentally misunderstand our argument here. They say that we're not actually solving for this. However, my opponents are actively discouraging minorities from participating in research, and risky research in particular. My opponents say that minorities are already in the healthcare industry, therefore it's not like therefore there's already enough people there. But think about this logically. If there were already enough people in medical testing, then medical researchers would not offer money. So it makes absolutely no sense to believe this. And they say that all of the disparities in healthcare are because of racism, and they say that medicine is diverse. However, they're not actually interacting with our argument. Our argument is that minorities, like the African American community, they already distrust the medical community because of pretty understandable reasons, because of historical racism, because of all the things that we talk about. Therefore, if they see tons of disparities in drug care, they're obviously not going to want to participate in medical research, which means that all of this compounds, because minorities won't participate in medical research even more, which means we have less of an understanding for them, which means disparities continue and even increase. My opponents say that we can't solve for distrust. We can solve for distrust by eliminating the disparities between minorities, and that can only happen by testing minorities, which can only happen through financial incentive, which is the only incentive that can overcome the historical racism that drives people away from the medical community. These are all reasons that should be flowing through this round. My opponents have not adequately responded to them. When you're weighing, you're going to be weighing solving diseases first, health first. And the only way we can solve diseases is through category 1 testing. That's the only way we can have experimental treatments that actually work for dangerous diseases we haven't solved before. And onto the affirmative. My opponent's first argument was about bad medical research. We said that my opponents aren't actually going to solve for like uniform testing. They're just going to flip it to the other side. If young people go get treatment because of the financial incentive, my opponents are going to make it so that only old people do. My opponents say that this somehow is only going to balance out, and then they say, look at the status quo. How can we look at the status quo when my opponents haven't provided any examples? They just say that this exists in the status quo and don't prove it. They don't have any logic. If you logically look at this, it makes no sense that that medical researchers would be wasting thousands of dollars if they already have sufficient numbers of people and if they already have uniform distributions. My opponents are only going to be decreasing the uniformity of medical research. And my opponents also said that poor people are more likely to have bad diseases, which leads to worse medical research. However, in medical research, like questioning is really robust. When people research, they're gonna have like a really good questioning that would identify any possible risks. So all of this would be accounted for. Like medical researchers are really like on top of their thing. They know how to conduct research really well. And for my opponent's second argument about financial incentives, we respond by saying that people already have informed consent. My opponents say that the language people are told informed consent about is often confusing, and they give the example of pharmaceuticals. But the problem with this argument is that the scientists who develop the medication want their medication to succeed. They do so out of the good of their hearts, whereas pharmaceutical companies just want to get money. So doctors would be more likely to have better testing. And also, we just completely outweigh this argument. And for their third argument about financial incentives increase harm, my opponents dropped the argument that my partner makes about how people undergoing testing already receive treatment from the researchers. For these reasons, I negate. Thank you.
Okay. Is everybody ready? Cool. I'll start time now. The reason that the opposition wins today's debate round is because there is no answer on part of the affirmative to the argument that if people are not given money to participate in this medical research, there is no reason as to why minorities, young people, all of the groups that they talk about will participate in the medical research. As a result, you're actually going to be seeing less diverse research. You're going to be seeing less effective medical research in terms of like drug production. You're going to be seeing all of the harms that they talk about actually exacerbated by the affirmative team. Let's go into the logic of how this works. On the first contention, we are able to tell you throughout the round that you have to look at this logically. If people are not given incentives, there is absolutely no reason for them to participate. They say two different things throughout the round. They'll tell you, one, that people are still going to do it because they like medicine, like extend the arguments that we give you as to how minorities and people like this are working paycheck to paycheck. They don't have the ability to just spend the time and money to not go to their job and go to medical studies instead. Thus, they can't go to those things, and thus we see less productive medical research. Or two, they try to tell you that these people can do it as a result of, wanting and having the desires to make medical research better. Again, this is pretty obviously countered. There's no reasoning as to why these people would want to do it, given the fact that they're not given compensation. The first argument of our side and their side directly clash because they're trying to tell you throughout the round that this is going to lead to better research if we're able to get rid of this compensation. But there's no reason that they give you as to how, when these young people leave, when these minorities leave, that's going to create a balancing effect, because that's the entire crux of their argument. They need to prove to you that this is going to create a balancing effect in order to win the round, but it's not, given the fact that all of these people who are minorities, all of these young people would no longer be in the research. It's pretty clear that we're the only team that is able to create more medical advancement. We're the only team that is able to see an increase in medical innovation, and we're the team that is able to actually maintain the level of medical innovation that we see in the status quo, which saves people's lives, right? Just also extend the argument that affluent people obviously are going to be the ones participating in these studies now, which means that you can't really solve and you can't really create these diverse medical treatments. They concede that a lack of financial incentives would decrease risky research. And what this means is that risky research is key, because things like risky research are what lead to things like cancer being able to be solved. And as a result of that, we see the biggest harm and the biggest impact in the round solved. Let's go to the second argument about diversity. It's pretty clear that our diversity argument mainly just outweighs the affirmatives argument, because what we're able to tell you here is that when you have this historical distreatment, when you have this historically poor treatment of minorities in the medical system, and then all of a sudden you just get rid of the financial incentive, and then you have all of this treatment going towards affluent people, non-minorities, right? We're going to be seeing that this leads to just much worse treatment for minorities overall. And they actually drop the argument under this contention that trust in the medical community is uniquely important, given that COVID-19 is a thing right now and is in our society. And without that medical trust, without that trust specifically in the medical community, we're not able to solve for COVID-19 infections. COVID-19 infections is another very high magnitude impact in today's round, because if we're not able to solve for those infections, it means that we lead to a continual pandemic, which is going to mean that obviously people are dying, people are getting ill, the economy is not running successfully. We see all the effects of COVID-19 just amplified justified as a result of the affirmative case. Their only other argument that they can give to you is that how this increases harms. Again, extend the argument that they contradict themselves, because if people or minorities don't have the money, don't have the income to be able to correct a lot of the problems that they're receiving in this medical research, then they need those financial compensation. They need that financial money to be able to actually solve for that. They need that money to actually be able to solve for those harms that they're dealing with when they get that medical treatment. It's pretty clear that we win both on the prerequisite argument and diversity.
Okay, so I will be going over 3 voting issues in my rebuttal today. The first is that of the safety of these experiments. We increase the safety of these experiments with no financial incentives. With financial incentives, researchers don't have to make their experiments as safe in order for people to sign up on them. People will sign up for them. People won't sign up for medical experiments that they know are people will sign up for really unsafe medical experiments if there's a financial incentive. If there is an absence of a financial incentive, there is a higher bar when it comes to safety for people and their willingness to participate in the study. Right now, researchers who are trying to, push drugs, make money for their company by getting a drug out on the market as soon as possible, actually have the opposite incentive to making sure that their study is as safe as possible. They're trying to get it out as fast as possible, and this means overlooking the testing on animals. This means, glossing over things in the interest of time and in the interest of money. The other side wants to come at you and say that it is not possible to make that medical research safer. However, this is not really that true. So let's say you're a pharmaceutical industry professional and you're trying to promote a new drug to treat hair loss or something. And if you can do this in a year, you'll get a lot more money than if you can do it in 2 years. So they have an incentive to make this process as fast as possible, which often comes at the expense of safety measures. So when they're doing their testing on chimpanzees or whatever, they won't do it as rigorously. They won't collect as many data points. So basically, the safety of the study going into testing on humans is automatically decreased simply by nature of the pharmaceutical industry and how these things work. However, when pharmaceutical professionals know that they're not able to get away with pushing a dangerous study, they have to make sure that their study is safer than they would have otherwise, or else they just won't get enough participants. If it is safer, more people will sign up. If it is unsafe, you can bribe people with money in order to make them participate. So you see that with the absence of financial incentives, you see an incentive for people actually developing these experiments to make it safer. You see a decrease in the negative side effects that people get from these medical studies. You see an increase in the trust in the industry because the studies are proven to be safer. All of these things happen as a result of a lack of financial incentives. Okay, now let's look at if people will participate if there is no financial incentive. They say that financial incentives are the only thing driving people to participate in studies, especially those in marginalized communities. However, we come in and tell you that there actually could be an increased suspicion with the presence of a financial incentive because people that have been historically marginalized will think, oh, they're just trying to buy us off. This point has gotten unrefuted, so you can actually think that financial incentives could increase suspicion. Furthermore, we present to you that there are people who really care about these issues, people in the medical field, which just happens to be extremely diverse. So people who are in the medical field will volunteer to test on these things because this is their passion. This is what they live for. And this industry also just happens to be diverse. Furthermore, we can see that you don't eliminate suspicion with financial incentives. Again, it might actually increase suspicion. Financial incentives were used to try to get people to get vaccinated and didn't actually have that much of an effect. They just ask, why would you do it if there's no money? Because it's not always safe. Well, first we say that without financial incentives, experiments will be safer. So the point of it not being safe won't be as much of a factor in people's minds. But however, we can see that medical professionals will volunteer for this. People will volunteer for this. And if there's a disease that's like ravaging a neighborhood and people can have an opportunity to change that, they're going to, because they want to do something that'll help society and help themselves if things really do get that bad. And lastly, when we look at the accuracy of medical studies, we can see that it shifts to low-income people. And this is bad primarily because when it shifts to low-income people, they are less equipped to being able to take care of potential long-term side effects than their high-income counterparts. Even if the studies skew to high-income people, it is better than it's skewing to low-income people, because high-income people are more likely to be able to treat long-term side effects that may result from the medical study. So because people will be safer in medical studies without financial incentives, I strongly urge a vote for the government. Thank you.
Okay, very nice, everyone. Judges, when you have submitted your ballot, if you could just send me who you voted for, and when I have all 3 ballots, I will announce. Yeah, no, I've already decided, but I don't have a ballot. I didn't get an emailed ballot. Oh. Okay, well, I was just gonna say they could send a private message to me. That's what we did last time. But fine. I mean, I'll defer to you. Last time they told me which side, and then I said after. Okay, that's great. You can announce. Okay.
I know that Berkeley, oh no, it says on the room, never mind.
Joel, can you explain to me how to clear my ballot? I don't. Yeah, because I already submitted a ballot, and so like.
What you want to do is, you know, at the top.
Okay, yeah, if I click it again, I get a new one. I'm good. Okay.
Recording stopped.
Joel, I imagine you know the results, considering that you can see all three. Would you like to announce the winner, and then we can go with our individual feedback? All right, so congratulations, and I think I'm going to go give my feedback first. So after listening to the affirmative negative speech, I circled two things. One was that we're going to shift recruitment, and that there's not going to be a significant increase and decrease in the number of participants. Then two, that scientists would then need to make these things safer to maintain the number of people who participate. And so the first one got a little murky, and I think I preferred the financial explanation coming from the opposition, that I think they plainly stated, like, these financial incentives wouldn't exist if they weren't necessary. And I needed a response to that. And you could have said, like, scientists are really evil and they want poor and minority people to participate because they know it's not safe, but you didn't, or you could have come up with some other explanation. But I didn't have sort of like an answer to that common sense question, like, why do these financial systems or financial incentives exist if they weren't necessary to increase the number of people? I just need an explanation of that. Then I also needed an earlier explanation about how scientists could make these tests safer to begin with. I don't really get something until the third speech when you talk about they can extend the time frame from a year to 2 years. I needed more of that earlier on, and I needed just more of it in general, because I think the negative gave a good explanation as to, well, actually, these things have to be risky because you have these categories, and you always like test animals first, then you test people, and also in regards to that, like, there's always going to be like a test that's like first on people to prove that it works on people. Like, there's always going to be some intrinsic risk to that. So I needed more explanation as to how. I get the incentive structure that, like, scientists need to get people in, so they have to make it safer. I just kind of buy the negative argument that that's not even possible. So any questions regarding my feedback there on either of those two things? Okay. So that was my number one thing. I like the example of COVID, always good to bring in, modern stuff from the negative. In your third speech, you say cancer instead. I mean, maybe that's some sort of feasible thing, but I think you should have stuck with what your partner said about the RNA vaccines and whatnot to keep that line of thought going.
Okay, I'll go next.
Yeah, go ahead.
I also voted opposition, and I thought I agree with pretty much everything that was just said. I thought that net benefits was an odd sort of value to run, because I think they're going to, just intuitively, as they said, there's going to be certain research that's risky. Sure, you can make it less risky, but it's still going to be risky. I just think that's sort of common sense, right? And they seem to know a lot about 1 through 5, and so I accepted that to be true since I didn't hear anything coming to counter that. So then if you had valued something like eliminate exploitation based on historical injustice or something like that, and defined the value very narrowly, because I think intuitively we could all agree that people who are financially strapped may have more incentives that result from their historical disenfranchisement from economic gains. That being said, I agreed with pretty much everything that was said. It seemed that net benefits in terms of innovation of drugs was going to outweigh. So I voted out.
So I agree with both the previous judges in terms of the direction of the debate. I think that a lot of time was spent, for both sides, I think there was a lot of time spent trying to explain why the other side's world is not that good. And ultimately it was a bit frustrating, I guess, as a judge, because it felt like until the rebuttal speeches, there wasn't a painting of this coherent picture of why exactly their world or their motion is the better is essentially the better. There was a lot of times saying theirs is worse, but not mine is better. And it wasn't until rebuttal speeches that this really became clear for both sides why they're trying to say that their will is better. The negative saying that that financial incentives are necessary, and then affirmative saying that experiments will improve due to reasons such as they will improve because there will be like a higher level of rigor because there's no financial incentives. But ultimately, I had to go back to the first speech and think about what examples were given and how concretely were cases put together. And that's why I voted for government, because I thought that their evidence was a lot more concrete in terms of the directions. For example, the COVID example, although I guess that was from the second speaker, not the first speaker. But to me, that's why I voted in favor of government. But I will say that I do, for the most part, agree with the direction the judges put forward.
All right, everyone. I hope you had an amazing 2 days of the tournament, and congratulations to the team that's going on to the finals, and congratulations to the team that got to the semifinals. That's a real accomplishment.
I did owe that. There was a lot of really good thinking and analytics going on, and it's sort of nice to see a return to parley, you know, values and just on the fly thinking. And it was nice to see both teams did exceptionally well. So thank you for this round. It was a pleasure.
Thank you.
Thank you so much.
Thank you, everyone. Good luck.
Thank you.
Y'all are a great team. Good luck.